At this year's ASCO, Yale Myeloma team is presenting data from this phase 1b to 2 study utilizing SLAM-F7 checkpoint inhibitor Elotuzumab in combination with antibody-drug conjugate Belantamab mafodotin for patients with late relapsed refractory multiple myeloma. So this is a patient population with an unmet need. And in this study, we're currently presenting phase 1 portion of the study, which has been completed, and we have expanded to the phase 2 portion. And just to comment on briefly on the patient population in this study, patients were triple-class refractory, all of them, and 80% of patients were penta-drug exposed, and 40% of patients had prior BCMA-targeted therapy exposure. And the primary endpoint of the study was safety and tolerability of this combination. And fortunately, the preliminary safety results show that this combination is pretty well tolerated and non-toxic. We did not experience any dose-limiting toxicities. And in terms of side effect profile, ocular keratopathy was noted in 40% of patients. This is a side effect of Belantamab mafodotin. So 40% is relatively reasonable for this combination. All of these events were grade 1 to 2 and resolved after dose modification or discontinuation or withholding the drug. Other side effects were actually quite tolerable. Hematologic toxicity in the form of neutropenia, thrombocytopenia were on the order of 20 to 30%, which is encouraging. Infectious side effects were also on the order of 30%, mostly pulmonary infections. Most of them were grade 1 to 2, only one was grade 3. So favorable safety profile overall. And so for this small cohort of patients, the preliminary efficacy is actually encouraging in that we have seen 40% of partial responses in this heavily pretreated relapsed refractory population of patients. And so this is encouraging, and I have to comment that another 30% of patients experienced what looked like a durable, stable disease, which may be meaningful in patients who are heavily relapsed refractory. Of note, 4 patients who had prior BCMA targeted therapy, 2 out of 4 experienced partial responses, some of which were durable. So overall summary is that this combination of Belantamab mafodotin and checkpoint inhibitor Elotuzumab appears to have reasonable safety profile and encouraging preliminary efficacy for this population with unmet need, relapsed refractory myeloma.